million people with the disease worldwide. Thanks to early detection and also the advancement of examinations and treatment, the 5-year survival rate now in Japan is over 70%. But many rectal cancer patients who've undergone surgery lose their anal sphincter function. At this hospital, however, over 90% of rectal cancer patients have been able to keep their anus, which means that they have full anal sphincter function.
Dr. Okuda is a surgeon specializing in rectal cancer. His team has succeeded in preserving the anus in 94% of surgeries they've carried out.
肛門に関してはまだ依然ね大きな差があってお尻から5センチ以内の進行がんは男性の場合特に永久人工肛門ですよと言われるのが標準的なんで9割方ねそういう意味ではうちに来られてこうやって肛門を残すという今のところまだ非常にねレアケースです。
The large intestine is about 1.5 meters long. The rectum is the part near the anus and is about 15 centimeters in length. If cancer develops within 5 centimeters of the anus, many doctors surgically remove the area from the anus to just before the start of the rectum to avoid recurrence. Then, they make an opening in the abdomen and connect the colon to it to create an artificial anus or stoma. Patients will pass waste through the stoma for the rest of their lives, making their daily routines more challenging. However, Okuda's team has succeeded in preserving the anus in over 250 patients whose rectal cancer was within 5 centimeters of the anus. This requires highly advanced skills and can only be done by a handful of doctors. The procedure involves laparoscopies from both the abdomen and anus. The anus has 2 rings of muscle around it, called the sphincters. The external sphincter will be preserved. First, the colon is detached from the membrane which connects it to the surrounding tissue. Then, a cut is made between the internal and external sphincters. Next, the rectum is pulled out of the body through the anus and the cancerous area is removed. It is then sewn to the anus to preserve anal function. Until the tissue joining the colon and anus has healed, fecal matter could leak into the abdominal area. To prevent this, a temporary stoma is created using the small intestine. After 3 to 6 months, the stoma is removed and the intestine is reconnected.
Professor Okuda, thank you so much for your time today.
Oh, I'm very, very happy to. I'm very pleased and honored to welcome you to Osaka Medical College.
Thank you so much. 今日よろしくお願いします。
こちらこそお願いします。
With colorectal cancer, it can affect different parts of the colon, different part, and obviously the rectum as well. Are there any parts of the colon or the rectum that are particularly difficult to treat?
The most difficult part is rectum, cause a very narrow place, and especially the male patient very deep and narrow, and well, especially with obese patients, very, very difficult.
This is one of the patients for whom Okuda felt anal preservation would be difficult. Daikoku Akio realized he was ill 4 years ago when he noticed blood in his stool. He had a 2-centimeter wide tumor located close to his anus. The cancer had also spread to the lymph nodes near the rectum. It was stage 3A cancer.
それをもうちょっと早く気づいてたら、何でしたか内視鏡で手術が終わるようながんの間にしとけばよかったなってはすごく思いました。
Daikoku's obesity made surgery difficult. The thickness of his subcutaneous fat prevented the creation of a stoma.
これぐらいのですね、内臓脂肪もそうですし、腹壁脂肪もあるので、一時的人工肛門を置くのは難しいと。 腸がここへ出てこないと、外へですね、もちろん出てきてもまた落ち込んでしまうかもわからないということで、それで人工肛門は、通常置けないだろうというふうに見たわけです。
One option was to surgically remove the anus and rectum, but Daikoku was still in his 40s. Okuda wondered if there was a way to preserve his anus.
肥満の強い人は、ちょっとした合併症に弱いですから、で腹膜炎なんか起こしたら命取りになると、命を取るかそれとも肛門を取るかでしょ。しかしどっちも取るみたいな。
Okuda pored over many studies in search of a surgical method that allowed patients to keep their anus. A procedure developed in the 1930s caught his attention. Okuda worked with a Brazilian doctor to revive the method. It was not widely adopted at the time because the level of technical expertise was insufficient to produce many successful cases. Okuda named it reborn surgery. It involves pulling the rectum out of the patient's body and removing the cancerous area, just like in a conventional anus-preserving surgery. The difference is that the remaining colon is left outside the body for 1 week. During this time, patients can excrete through it, and the colon sticks to the surrounding tissue inside the body. Once it has stuck and blood flow has been confirmed, the section left outside is removed. The remaining part is sewn to the tissue. This allows patients to survive without having to rely on a stoma, even temporarily.
Why did you actually develop this new surgical technique?
I must do that, otherwise I cannot save this patient. And I was, struggling how to do, and look up many medical books. At that time, I found this kind of procedure that is invented 1930 to 1960, and I get together with Dr. Amon Melani. We must use the original one to change by ourselves in our own way.
You named it Reborn.
Yes, this kind of technique is anus becoming a baby again, and initially many stools out, no good function. However, 6 months, 1 year, getting the function better. That's reborn.
And obviously when you're performing rectal cancer surgeries, some of the patients are left with an artificial anus and a stoma, and I would imagine that that's, rather than survival, it's something which you do every single day, and I would imagine it's a big dramatic impact on daily life too.
But an artificial stoma sometimes, artificial stoma, yes, is sometimes very better for some selected patients, elderly, and almost in the bed. At that time, their family is very, very hard to take care of their pet. The artificial stoma can take care is very easier.
And that makes sense.
Think about the cancer. Most patients probably will ask me, can I survive? Can I cure? Like that. However, the rectal cancer is different. The most important point to how to cure the cancer, they want to keep the anus.
So you're probably seeing incredibly complicated cases too.
Yeah.
I'm sure everybody sends you the most difficult cases in all of Japan.
Yes, that they're coming, I do my best.
So is it more difficult then to operate in a man than a woman?
So man is more difficult. The status of the pelvis, as you know, that female have a birth, delivery the child.
Yes.
That is a little bit wider compared to the male patients. And the male patient is very narrow and deep. And in addition, the rectum is covered by the nerves, pelvic nerves. That is very, very important. Nerves controls urinary, urine, and sexual function. Especially the male patient, erection and ejaculation is very important function. And nowadays, not obese patients want to do this kind of operation.
Fujishima Hiromi wants to have the reborn surgery. A different doctor told her her anus removal would be essential.
何もしないままだったら半年だって言われてたので、もうその半年を有益に過ごす方を選びたかったんです。で、娘も夫も人工肛門つけてでも生きていてほしいっていうふうに言われて、そこから人工肛門をつけなくてもいいような病院と先生を探す気持ちに切り替わりました。
Okuda decided to do reborn surgery on Fujishima using an advanced surgical robot called Da Vinci.
これでいけますね。はい、ごめんなさい、お願いします。
He uses a console to control the robot, which enables him to perform delicate and precise tasks. The colon is attached to surrounding organs and tissue by a membrane. First, Okuda removes the part of the membrane that connects the colon to the left side of the pelvis. The colon is visible in the lower part of the screen. The pelvis is located in the upper part. Okuda carefully removes the membrane so as not to damage the surrounding tissue.
これが尿管ですからね。おしっこなんか動いてるでしょ。ビワーッとこれね。
If the ureters are damaged, urinary function will be lost. The colon is surrounded by many important nerves and blood vessels. Da Vinci plays a key role because it enables intricate and stable operations. Okuda performs the surgery in a team. One of the other surgeons next to the patient helps him by widening the surgical site. Here, the surgeon is holding the colon with forceps.
で、手前引いてください。でも5時ね、先生。はい。そうです。ありがとうございます。そう、素晴らしい。そうするとよく見えますね。
3 hours into the surgery, Okuda has managed to detach most of the membrane. He is working on removing the area near the anus. Another surgeon participates in the operation using a laparoscope via the anus. He separates the internal and external anal sphincters, leaving the external one in place.
聞いてる？あ、そう。ちょっと僕の前の左がね、僕の方がちょっと良くないんですよね。だからそこをちょっと補ってもらったら。後ろを右左。
At this point in the surgery, Okuda constantly talks to the surgeon who is operating the laparoscope from the anal side.
あ、来たね。今繋がった、見えた？出た出た。出たでしょ。どうやーって感じで。あ、これでいけるね。先生のその監視を頼りに行きますよ。うん、ありがとう。これで OK やね。はい、ありがとう。おめでとう。
Their teamwork leads to a successful surgery. The team managed to pull the rectum out of the body without damaging the external sphincter. After the cancerous part is removed, a section of the colon will remain outside the patient's body. cancer that developed 2 centimeters from the anus has been removed completely. Depending on the patient, reborn surgery usually takes 3 to 4 hours and causes blood loss of only 10 milliliters.
So in this case, you've got how many surgeons are working together?
Good thing, once we introduce robot, the patient side is only one assistant and me. So abdominal side is 2 surgeons and transcranial side is 2 surgeons. In total 4 surgeons.
How do you then get together as a team and work out which patient should be treated in which way and whether you use Da Vinci or don't use Da Vinci? And how do you then sit down and really assess this?
We must communicate with the patient and their family much more. Talk about the situation and talk about what they want to do, and after that we must determine which procedure and which device appropriate to them. We have a good surgical team with now 5 staff. From this April, 2 more 7 staff. At that time, we talk about much more, talking about especially the tailor-made surgery, tailor-made, like this kind of clothes.
And to be involved in the process, even if they're quite young coming in with different ideas, it must be such an interesting collaboration, I would imagine.
Yes, and emerge optimal surgical team. So each surgeon has a good talent, his or her own good talent, and their ability. We must find out their each talent and ability to get together.
Okuda performed reborn surgery for the first time in 2016. Daikoku was patient number 1. His life returned to normal, and the cancer didn't recur. But recovery took time and patience.
退院した後も、やっぱり、歩いてる時に出るかもとか、だからついそこの、スーパーまで行けるかとか、っていうのがあったし、そうこうしてるうちにだんだん髪のシミもつかなくなってきて、だんだん分かるようになってきたので。
He traveled to Hawaii 6 months after the surgery while he was still undergoing chemotherapy.
ちょっとこの時は本当は顔弱笑ってますけどちょっと辛かったんですけど、生きててよかったなと思いながら。
By 2019, his bowel leakage had mostly been resolved. He traveled to Australia's Uluru, also known as Ayers Rock.
本当に日にち薬で、本当に岡田先生おっしゃられたようにリボーンですっておっしゃったみたいに、今2歳かとかようやく3歳か3歳半かって思うとこんなもんかもしれんなって今の状況だとすごく良かったなって。
Okuda is working with doctors overseas to improve the procedure further. He posts videos of his surgical methods on the internet. He wants to save as many rectal cancer patients as possible.
And I think, again, working with people from around the world, everyone then sit down and collaborate in terms of what everyone else, sharing information of what they're doing and how to improve and how to probably make it more, and really improve it for the patient.
Yes. Not only the technique, but also the control of the operative function.
So, Professor Okta, how do you imagine medicine to be in the next few years?
Very, very good question. And before that, please see this one is nowadays we have an operation here in Takatsuki Osaka Medical College, but in a couple of years, I don't have to be here. Imagine.
You'll be in home?
No, everywhere.
Really?
Yeah, cause 5G surgery.
How does it work?
Of course, in a 5G, 5G works a lot, and no time loss.
Yeah, zero time loss.
Zero time loss, so we can operate from outside very clearly. And reduce medical level gap among the regions. Even in the countryside, we can do the same operation from here.
Which is incredible. Because this is the thing, surgeries are critical. You can't wait for surgeries. But at the moment with what's happening worldwide, I mean, this is the perfect solution.
Yeah.
So, Professor Okuda, in terms of saving as many patients as possible, what are some of the things that you're also working on?
I must, to proceed the educational system. We must educate many other surgeons to make a better and better network and team to save much more patients everywhere in the world.
I think we need to clone you. Make a clone of Professor Okuda so he can go out and save as many people.
Not clone, they will live on.
That's a great word, exactly. So thank you so much for your
Thank
time.
you very much. Thank you so much.
先生ありがとうございます。
ありがとうございます。お気に入り。